Let's return to This Week in America. Here's your host, Rick Bratton.
Welcome back, everybody, coast to coast. This Week in America. Medical Decisions for a Loved One with a Life-Threatening Illness by Dr. Gannel Jean-Pierre is a wonderful resource for people dealing with a life-threatening illness or who have a loved one in such a situation. He is a palliative care consultant for various skilled nursing facilities in the Bronx and Yonkers areas of New York, a passionate advocate for the rights of patients and/or responsible parties to be allowed to make informed and guided advance directives and medical decisions. He earned a bachelor's degree in nursing from the Nursing School of Fairfield University at Connecticut, a master's degree as a family nurse practitioner from Southern Connecticut State University, and a doctoral degree as a nurse in nursing practice from Columbia University in New York. He was a fellow in the postdoctoral Palliative Care Fellowship Program at Columbia University and an advanced care certified hospice and palliative nurse and an oncology certified nurse. Dr. Gannel Jean-Pierre, author of Medical Decisions for a Loved One with a Life-Threatening Illness, is our guest on This Week in America. Dr. Gannel, welcome to the program. It's great to have you with us.
Thank you. Great to have me.
So important, all of the issues we're going to be talking about in the program. And let's start with the inspiration. As I'm reading the foreword to the book, the introduction, you state why this happened. And this was your instincts as a doctor, realizing this really needed to be done. Talk about the inspiration for writing this book, Medical Decisions for a Loved One with a Life-Threatening Illness.
But Rick, people who are dealing with a life-threatening illness or people who have a loved one dealing with a life-threatening illness need the guidance of a palliative care consultant to help them make advance directive decisions, meaning healthcare decisions made in advance about how they want to be treated or how they want their loved one to be treated for their life-threatening illness. Unfortunately, there is a shortage of palliative care consultants needed to do that job in the community. So this book will help from people who are dealing with a life-threatening illness or people who have a loved one dealing with a life-threatening illness to understand how to make informed and guided advance directive decisions throughout the trajectory of the life-threatening illness.
And you do this in an easy-to-understand way, a lot of this from practical experience that you've had. Our guest on the program, Dr. Gannel Jean-Pierre, I'll give you all the information on the book. The book is Medical Decisions for a Loved One with a Life-Threatening Illness. Available wherever books are sold, Amazon, of course, and all of this information on our website. Palliative care is something it's a reasonably new term for most people. What exactly is palliative care?
Palliative care is an interdisciplinary specialty that aims to improve the quality of life of patients and their families facing the problems associated with a life-threatening illness by relieving physical and emotional suffering so that patients and all their family members can stay focused in the management of the life-threatening illness.
I mentioned life-threatening illness. Exactly what is that? In your eyes, your definition, what is a life-threatening illness?
A life-threatening illness is defined as any medical conditions that may cause physical and mental limitation and or impairment and death. Life-threatening illness include any medical condition and any other illness in an advanced stage that is no longer responding to curable treatment. Example will be late stage heart failure, late stage lung disease, advanced cancer, or late stage dementia.
With us on the program is Dr. Gannel Jean-Pierre. Now, I'll spell that now a little bit later if you're Googling. That's Gannel. Jean-Pierre is JEAN-PIERRE. All this on our website, of course. The name of the book is Medical Decisions for a Loved One with a Life-Threatening Illness. Book available at Amazon, all of the usual places. Doctor, what's the difference between palliative care and hospice care?
Both palliative care and hospice care plans focus on relief of symptoms and stress of a serious chronic illness. It's about timing. Palliative care is appropriate at any stage in a life-threatening illness. Hospice care is appropriate only in the last 6 months of life, as estimated by the patient physician. Hospice care is offered in place of curative treatment, whereas the comfort of palliative care is available at any time in a patient disease, from diagnosis and throughout the curative treatment.
You talk a lot about the principle of autonomy in your book, Medical Decisions for a Loved One with a Life-Threatening Illness. What is the principle of autonomy, and why is this so important for the patient?
The principle of autonomy includes the ideas of self-determination, independence, and freedom. Freedom from being influenced by any external factor. Freedom to make one's own decision. Autonomy is one of the core ethical principles that underpin the provision of palliative care and promote the doctrine of informed consent. Thus, patients have the right to accept or to refuse medical care, and they also must be educated about any medical intervention that they are going to undergo so they can make informed medical decisions.
So much information, needed information, in the book Medical Decisions for a Loved One with a Life-Threatening Illness by our guest on the program, Dr. Gannel Jean-Pierre. We talked before about advance directives. Give us a little more information, what they are and why they are so important. Oftentimes it's sort of an intimidating term and we don't want to face that, but boy, it's really important, isn't it?
It is a legal document. Advance directive is a legal document that explains how you want medical decision about you to be made if you cannot make decision for yourself. Advance directives are then medical decisions that patients make in advance, for the future, about what kind of health care they want if they are unable to make medical decisions for themselves. Example will be selecting a healthcare proxy or writing a living will.
Who can actually make decisions for a patient?
A competent patient himself make medical decisions. But if incapacitated, his healthcare proxy will make medical decisions. If there is no healthcare proxy, a next of kin. If there is no next of kin, attempt to find a surrogate will be made to make medical decisions for the patient.
That again comes back to the importance of advance directives that the doctor was talking about. In the book, you address symptoms management. Talk about the role of that and why that's so important.
Symptom management is key. Patients with a life-threatening illness are prone to physical and mental symptoms due to the side effect of treatments and or the progression of the illness. These symptoms may include pain, shortness of breath, digestive problem, depression, anxiety, etc. Patients assess their quality of life as poor when they are uncomfortable. Severe symptoms can decrease their willingness to continue fighting against their life-threatening illness. They make them feel angry, irritable, not willing to have people around. Consequently, symptom management is key in palliative care and need to be managed.
One of the chapters you talk about caregiver burnout, and that's so important. Talk about that because you see it on a daily basis where you're dealing with patients and caregivers. And boy, there comes a time when it's difficult for a caregiver to balance their life along with the life of the person they're extending care to. Talk about caregiver burnout.
Giving care to somebody that you love is a satisfactory and gratifying endeavor. However, caregiving is a very demanding job. It is full of physical, economic, and emotional burden. Researchers who study the burden of caregiving talk about a phenomenon called caregiver burnout, meaning fatigue, exhausted. If you are a caregiver, make sure that you eat and exercise adequately. Take a break and find a time to rest and to sleep.
All of this pointed out in Dr. Jean-Pierre's book, Medical Decisions for a Loved One with a Life-Threatening Illness. Book available at Amazon, Barnes & Noble, all of the usual places. A link on our website, thisweekinamerica.us, will take you directly to the doctor's Amazon page. You can order the book there as well. Let's talk about grief. It's something that you talk about extensively in the book. How do we deal with grief? It's a very important part of caregiving, isn't it?
Yeah, ultimately, unfortunately, when patients are dealing with a life-threatening illness, the end of life and dying is one of the outcome, unfortunately. So grieving is normal. It includes the entire emotional process of coping with a loss. Grieving is a long and sometimes tumultuous process that is responsible party goes through after the loss of a loved one. Grieving is a journey that requires substantial readjustment from the shock of the loss to the acceptance of the loss and the regaining of a normal life without the disease, but with memories.
The book covers all topics of what goes into care, and this is a resource book you talk about for healthcare providers as well. In putting this book together, what did this do for you? Did this even maybe bring up some aspects of healthcare that you've sort of had in the back of your mind and suddenly realized this is very important? What did this book do for you in writing it? Did it make you a better doctor, do you think?
Yeah, because I do understand the problem, the emotions when a family member or a patient is dealing with a life-threatening illness. It takes me time to compile all this experience and all the questions that they've been asking me. I compile all of them and put them in that book. This book also can be useful for somebody or a practitioner who wants to speak about palliative care, advent directive to their patient.
If somebody is listening and wondering, okay, how do I know if it's right for me? How does someone determine if palliative care is right for them?
I think palliative care, in that book, I talk about palliative care also, but I talk also about advent directive. If you are young, you can read about advent directive because you never know when a life-threatening will knock on your door. And then you can try to write a will and to select somebody as a healthcare proxy. And that gives you also an idea of what to expect. And also, if you have somebody, a family member dealing with a life-threatening illness, I think you will go to the hospital and you will meet with palliative care team. Sometimes you want to know exactly what it is. If you take that book and you read it, so you will be you will get the advantage to understand what is palliative care and how to make medical decision. And that will be all this book is about.
It's very simple. It's step-by-step. Book available wherever books are sold. Medical Decisions for a Loved One with a Life-Threatening Illness. Our guest is Dr. Gannel Jean-Pierre. Say that slowly so you may be able to write this down. I'll give you all this spelling before we finish up the program today. The book available, again, wherever books are sold. A link on our website. It's interesting you talk about from a patient standpoint, and you quote one patient in there as saying, never in my life have I been compelled to make so many decisions about my health. Talk about that because it can be overwhelming, and if you have the advanced directives we've talked about, it makes that a lot simpler for everyone involved, doesn't it?
Yes, yes, yes. Imagine yourself that you are doing well and you start complaining about a symptom or maybe dizziness, and you go to the doctor, they told you after working out that you have an advanced cancer. So all of the sudden, people will be asking you to make decisions about, depending of the stage of the cancer, about what to do, about advent directive, about what you want to know about CPR, like in chest compression and everything. So it become overwhelming. Now you are dealing with the emotions of a new diagnosis, and now also then you have a lot of questions and family members asking you questions. But if you take a time and you said, okay, let me try to educate myself, I think this book will help you out to understand all the questions they ask you and to help you make the medical decision that you need to make at this time. And your family member can read it also and help you out. Hopefully that you can find a palliative care consultant, but that can guide you. But if you cannot find a palliative care consultant, I think this book will help you out a lot to make medical decision and also to feel a little bit of peace of mind so you can fight the life-threatening illness.
You have your decisions made. Your family members knows that those decisions are made. It's laid out very simply to read, as I say, and it goes through all of the steps of the process. Medical decisions for a loved one with a life-threatening illness. If you get palliative care, do you give up your doctor? People like their doctor, want to have them part of the consultation. Do you need to give up your doctor?
Oh, no, 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 no. As a matter of fact, in the palliative care, like I said, is an interdisciplinary specialty. Your doctor is the one that that will direct the palliative care team, because your doctor know about your symptom. But in that team, the palliative care team, the doctor will invite other specialties. Like for example, if you are dealing with psych problem like depression, anxiety, they will invite a psychologist to probably talk to you all the time. Physical therapy, and if you need a nutrition, they probably invite dietary to be part of the palliative care team. It's the team effort, but the primary care provider is the one that will direct the team so you can get a better outcome for your treatment.
When should someone ask about palliative care?
Repeat that.
Yeah, when should they ask about that? At what point during their treatment should they ask about the care and look into it?
So, like I said, the palliative care can be introduced from the beginning at any time, at any stage of the continuum from diagnosis until the end. As soon as you are dealing, like remember we discussed about life-threatening illness, as soon as you are dealing with a life-threatening illness, palliative care can be started, and it would be better if palliative care start at the beginning of the diagnosis. So now you can address all your symptoms while you are taking curative treatment. That means you're being treated. So your symptom can be addressed, whatever physical or emotional symptom will be addressed. You will have a team that will follow you. That if you are not doing good, they know what to do to readjust. If you are doing good, they will know what to do. They will give you information about the treatment, the diagnosis, and we try to keep your mood elevated. I think palliative care, like I said, can start from really the beginning of the diagnosis. The doctor should recommend palliative care. We talk also about hospice. Hospice will be at the end when nothing else can be done, no curative treatment. Then we can introduce hospice when the doctor think or estimate that you have less than 6 months to live. But palliative care should be started at the beginning of the diagnosis or introduced at any point at any stage of the trajectory of the illness.
A couple minutes left in the program. Dr. Gannel Jean-Pierre is our guest, talking about his book, Medical Decisions for a Loved One with a Life-Threatening Illness. Who else besides the patient can benefit? I want to go back and emphasize that again, because the patient certainly benefits, but those around the patient, even the medical people, benefit from advance directive and the patient specifying what they want, don't they?
Yes, because this is how you can design a plan of care based on the advent directive, based on the wishes of the patient. So when the doctor knows exactly what the patient wants, with a little bit of guidance, then they can design a plan of care that will benefit the patient and the family members. So they can be comfortable. That would include the symptom management. That would include even going, advising somebody to go visiting, to go for a trip. When we know, because you cannot do that much if you don't know exactly what the family members or the patient know. So this book, Advent Directive, when we know what the patient wants, then we can design a plan in accordance with the medical staff and also the patient and the family members.
Unfortunately, there are family members that are faced with making decisions about treatment for an incapacitated loved one. Talk about the difficulty in going through that process.
That's a very difficult process, especially when you don't know what the patient wants. Yes. And the patient cannot tell you what he or she wants. So if the patient has a living will, of course, you can honor the living wills. Whatever the patient asks you to do, you do it, if it's possible. But if you have a patient that doesn't leave a living will, or you don't know exactly what's going on, that's going to be a tough process. So what you can do in that sense, you will try to call some friends and try to remember what kind of person that patient was, what do you think, and also what the doctor asks you, if it's possible. Then you will have to listen to the medical staff guiding you, telling you this option is possible, this option is not possible, or making futile. So you have to make the right decision, the decision that you think that will keep the patient more comfortable, that more adequate for the patient. This is how you make that medical decision. And sometime in the tough process, you can go back to yourself and say, if I were in a situation like this, what should I want? So in a condition like this, you should talk to the palliative care consultant that will try to explain to you all the medical options that make sense. And then based on this, the diagnosis, the prognosis, the medical situation of the patient, and they will try to guide you to make a medical decision that will be good, adequate for your loved one.
The book is very comprehensive. The book is Medical Decisions for a Loved One with a Life-Threatening Illness, Palliative Care for the Community by Dr. Gannel Jean-Pierre. Gannel is Gannel, Jean-Pierre, Jean-Pierre. Book available, Amazon, Barnes & Noble, all of the usual places. A link on our website, thisweekinamerica.us. Doctor, it's been a pleasure having you on the program. A very important book, an excellent job in making this understandable, and will make life easier for so many people that need the service and their caregivers, family members. Thank you for being with us on the program. Thank
you for having me. I think whoever has a loved one dealing with a life-threatening illness, please read that book, and I think it will make a big difference, a positive difference.
Well, as I say, you cover all aspects from beginning to end. A chapter in there on emotional, social, and spiritual needs. You cover all of the bases. The book, once again, is Medical Decisions for a Loved One with a Life-Threatening Illness. Book available at Amazon, the usual places. Information on our website, thisweekinamerica.us. We're back on today's program after these messages.
This Week in America is online. You can visit our website, thisweekinamerica.us. Scott Pinkerton, associate producer of This Week in America. Jay Anderson, segment producer. Ben Watson, webmaster. Otto Bechet, director of engineering and TV production. This Week in America produced and is a trademark of Blue Funk Broadcasting, LLC. For information on all of our guests and to listen to this week's show, our website again at thisweekinamerica.us. And I'm Sean Bratton, executive producer of This Week in America.